Hello, my name is Giselle Madiz. This is my competency part 2 for my health assessment class. Here we're going to cover the assessment for the head and the neck, the ears, the nose, the mouth and the throat, and the joints for the musculoskeletal system. Okay, I'm going to wait for my patient to come over here. Come in. Hello, how are you today?
Hi, I'm Reina.
Nice to meet you. Do you have some paperwork for me?
Yes.
Okay, great. What is your last name?
Eucros Torres.
Okay, what is your date of birth?
9/22/78.
Okay, perfect. Do you have any allergies that I may know?
No.
Okay, any accidents in the past?
No.
Are you pregnant?
No.
Perfect. Okay, any medication that you're taking at home?
None. Or
Perfect.
over the counter.
Perfect, no problem. Okay, you may have a seat. I'm gonna wash my hands. Washing your hands is the best way to prevent the transmission of infections. I'm gonna provide privacy for my patient, Miss Reina, and let me ask you, can you walk for me so I can assess your gait?
Sure.
Okay. And I see that the client is walking in a straight upward position, no stumbling or no limping noted, and I see that the shoulders are symmetrically by side by the patient arms. I don't see any abnormality. Okay, Miss Reina, you may go ahead and have a seat. Thank you very much. Okay, now I'm gonna continue with my assessment of the skull and the face. Okay, and I'm gonna go ahead and assess the temporal artery. Okay, I'm gonna make sure that she doesn't have any bounding pulses over here or any thickness. I assess with the pad of my fingers. Perfect. And I'm also gonna assess it with my stethoscope. With the bell. Let me know if you feel any discomfort, okay? Okay. Okay, I see the pulses normally, no bounding noted. Okay, I'm gonna assess the skull for any lesions or any bruises in the skull. I'm gonna assess the frontal part of the skull, parietal, and the occipital. Okay, and I see the contour of her face is symmetrically and normal to her body, okay? I'm gonna assess, let me know if you feel any pain.
No pain.
No pain, no lesions, no bruises. Okay, perfect. Now, Miss Reina, look at me. Okay, I'm gonna assess your eyes, your nose, and your lips. Can you smile for me? Perfect. I see the nasolabial folds symmetrically in your face. I see the outer canopy of your eyes, aligned with the pinna of your ear, bilaterally. I see symmetry in both of your ears. The symmetry in the size are appropriate for your face and your body. I see the skin is appropriate for ethnicity. I don't see no diaphoresis, and I don't see any abnormality. Okay. Now, after I assess her face and I assess her temporal artery, and I'm gonna go ahead and assess her neck for the structures. Okay. I see that you have symmetry in your face, your neck is appropriate for your body, no lesions, no bruises, I don't see any swelling, no lymph node visibles at first sight. Okay, I'm going to go now and assess her lymph node. I'm going to start with the pre-auricular lymph node in front of the ear. I have the post-auricular lymph node in the posterior to the ear. I have also the occipital at the base of the skull. I don't see no swelling. I don't feel any swelling also. Let me see over here. Okay, after I'm done with the part of the face, I'm going to go ahead and assess this retropharyngeal, which is at the mandible and the mandible joint. I don't see no swelling. Okay, I'm also assessing the submental below the shin. No swelling. This lymph node I assess with one hand because it's only one lymph node. I'm also going to ahead and assess the submaxillar, which is in the middle outer space of the mandible. No swelling noted. Okay, if you can please bend your head like this. In the sternocleidomastoid, there's the superficial cervical over here. I don't see no lymph node swelling over here bilaterally. Okay, and lastly, I have the supraclavicle lymph node, which are in the clavicle, superior, in this part of the clavicle. No swelling, no abnormality noted. Okay. After this, I'm gonna go ahead and assess any the carotid artery. Do you feel any pain when I touch you in the lymph nodes?
No.
Okay. Okay, I'm gonna go ahead and assess for bruit in your carotid artery bilaterally with the valve of my stethoscope. Okay, let me know if you feel any discomfort. Okay, no bruit noted. Okay, no swishing sound noted also in this side, no bruit. I will document this finding as normal, appropriate sign. Okay, and after I'm done with the assessment of the arteries, I'm gonna go ahead and assess for range of motion of the shoulder. Can you put your shin to your chest, Miss Reina? Great. Can you move to the left and to the right? Perfect. Can you put your right ear to the right shoulder and left ear to the left shoulder? Perfect. Can you shrug your shoulders also? Perfect. Great. Okay, I see no limitation. I didn't notice any crepitus when she moved her shoulders. Everything was looking good. Now I'm gonna go ahead and assess the TMG. Okay, I'm gonna put the palm of my fingers, 2 or 3 fingers, on top of her tragus over here, at her mandible. Okay, can you clench your jaw? Very good. Okay, can you open wide? Say ah. Okay, and close. Okay, can you move your jaw to the right and to the left? Perfect. Can you protrude your jaw forward? Good. Okay, I didn't feel any crepitus, or I didn't hear any weird sound. Okay, movement was smooth, no limitation. Do you feel any pain when I touch you, or when you move your jaw?
No.
Okay, so these are normal findings. I will document this as normal. Okay, after I'm done assessing her TMJ, I'm gonna go and assess the trachea for deviation. First, I'm gonna identify the sternal notch over here. Okay, no swelling, no tenderness. Do you feel any pain when I touch you? Okay. With my index fingers and my thumb, I'm gonna assess the trachea for deviation. Can you swallow? Okay. As she swallows, I feel the trachea moving upward. Okay. I feel the hyoid bones also. Can you swallow again? Okay. I feel the hyoid bones moving upward when she swallows. Okay. No deformity noted. Trachea is midline. No deviation noted. Do you feel any pain when I touch you?
No.
Great. So these are appropriate findings. And now we're gonna go ahead and assess the thyroid. So if you yeah, thank you. With my left hand, I'm gonna displace the trachea to the right, and with my right hand, I'm gonna assess and feel the isthmus or the thyroid as it moves upward. So I'm gonna give the client a cup of water, and when I tell you, Miss Reina, you're gonna swallow. Okay?
Okay.
Okay. Okay, you may go ahead and swallow. Good. I feel that thyroid moving upward as she swallow. Now I'm gonna do opposite side. With my right hand, I'm gonna displace, and with my left hand, I'm gonna feel the thyroid. Okay, you may go ahead and do it again. Okay, great. I felt it as it moved upwards again. So I didn't notice any enlargement. If I would notice any masses, I would document some. If anything greater than 5 millimeters, and I will document the size, the diameter, the shape, and the location. Ms. Reina, you said that you were not pregnant, right?
No.
Okay. Because for pregnant women, an enlargement of the thyroid will be an appropriate finding. Usually, women when they're pregnant, the thyroid enlarge. Okay, Ms. Reina, you may go ahead. Let me have a cup of water. Okay, after I assess the lymph nodes, the thyroid, the trachea for deviation, I assess the symmetry of your face, the structures of your face, and the contour. I'm gonna go ahead and assess your ears, okay? Now, first I'm gonna identify your ear. I don't see any redness, okay? No allergies, I don't see no lesion, no discharge noted. I see the pinna of the ear aligned with her eye, the tragus. I'm gonna touch you, so if you feel any pain, let me know. Any pain?
No.
Let me do it bilaterally. Any pain?
No.
Perfect. So both ears are symmetrically, no redness, no swelling, no discharge noted. I see the pin of the ear. I'm gonna touch it. Do you feel any pain?
No.
Okay. Any pain on this side?
No.
Perfect. Now I'm gonna use my otoscope and assess her tympanic membrane. Okay. Okay, and make sure my otoscope is working. I see the light over here. Can you move your head, yeah, to the right? So I'm gonna move the ear up and back for an adult. Okay. If you feel any discomfort, please let me know, Ms. Reina. I will stop the assessment right away. Okay. I see the amount of cerumen. It is minor amount of cerumen, not too much. I don't see no redness, no scarring. I see the tympanic membrane. I see it flat gray and translucent. The left ear, I see the light of the otoscope reflecting to 7 o'clock. Okay, no swelling, no blood noted. Everything looking good. Okay. Do you feel any pain?
No.
Perfect. So after I assessed her tympanic membrane, I noticed that there was nothing abnormal with her tympanic membrane, no discharge. The amount of cerumen was appropriate for the ear. It wasn't that much, and also the color was appropriate to her skin color. Now I'm gonna assess the other ear. Okay, so I'm gonna assess the right ear. Okay. I'm gonna go ahead and pull back and up. Okay, and I see the amount of cerumen is minimum, no blood noted, no scarring. I see the tympanic membrane gray, flat and translucent, and the light is reflecting of the otoscope at 5 o'clock. Okay, so I will document this as an appropriate finding. Okay, so after I'm done with my assessment with the otoscope, I'm gonna assess the rank test with my turning fork. What I'm gonna do, Ms. Reina, I'm gonna strike the turning fork with the palm of my hand, and I'm gonna place it in your mastoid bone over here. When you stop hearing the vibration, when you stop feeling it or hearing it, let me know, and I will move it in front of your auditory canal. Okay? When it stops, please let me know. Okay?
Okay, stop. Okay, it stopped.
Perfect. So I noticed that air conduction was greater than bone conduction. AC was 30 and bone conduction was 15. This is an appropriate finding, okay? So this is to measure that you have the bone conduction versus ear conduction is normal. Now I'm gonna go ahead and assess it in the right ear. I'm gonna strike it again in the palm of my hand, and I'm gonna place it in the mastoid bone.
Okay, it stopped.
Okay.
Okay, it stopped.
Okay. Again, the findings were AC 30 and bone conduction 15. Okay, Ms. Reina, that was great. I will document this as a normal finding. Now I'm going to go ahead with the Weber test. The Weber test is to measure the hearing in both of your ears. We want to make sure that you hear equally in both of your ears. So I'm going to strike the turning fork in the palm of my hand, and I'm going to place it in the frontal bone of your head. We can also do it in the forehead. It will be another side that we can do it also. Okay, I'm going to do it. 1, 2, 3.
I hear it equally on both sides.
Great. This is an appropriate finding, and this will conclude our Rhine and Weber test. Finally, we're going to perform the whisper test. For this test, Ms. Reina, I'm going to ask you to cover your left ear, and I'm going to whisper something. I'm going to cover my mouth. Yes, and close your eyes. And you're going to let me know what you hear, okay? It is cold in here.
It is cold in here.
Great. That was what I said. Okay, now in the other ear, I'm going to cover my mouth. Okay? It is a great day.
It is a great day.
Okay, so this is an appropriate finding. You pass your whisper test, Rhine test, and Weber test. Now we're gonna go ahead and do the assessment for the tongue and also for the nose. We're gonna start with the nose first. Okay, so for this assessment, I'm gonna use my pen light. Okay, I'm gonna make sure that you have patent nostrils, no discharge noted, no redness, no swelling. Okay, I'm gonna touch your nose. Please let me know if you feel any discomfort. Okay, I'm gonna assessing for patency, structure, no pain.
No.
Okay, no swelling, perfect. Okay, after I assess her nose, I'm gonna do the assessment. This is the assessment of the cranial nerve number 1. Okay, if you can close your eyes, I'm gonna give you a smell. Let me see if you identify the smell. Okay, I'm gonna place it in your nose and please let me know.
Oh, alcohol.
Great, alcohol. Okay, now cover the other nostril and I'm gonna give you another smell. Please let me know what you smell.
Coffee.
Great, coffee. Okay. After I assess her nose, I don't see any deformity. Her nose is symmetrical to her eyes and to her mouth. The color is appropriate for ethnicity. No swelling, no abnormality noted. So now I'm going to go ahead and assess the mouth and the throat. So for this assessment, I'm going to wear gloves. Okay. I'm going to use my tongue depressor. Okay. Let me see. Give me a second. Tongue depressor. Tongue depressor. Okay.